So this X-ray of the knee showing osteochondral defect of the medial femoral condyle. So here, the osteochondral defect of the medial femoral condyle. So you need to check any knee X-ray for the presence of the osteochondral defect, which is commonly seen on the medial aspect, commonly seen on the medial on the medial femoral condyle, but you can say it as that the osteochondral defect of the lateral aspect of the medial femoral condyle. This is more specific on the lateral aspect of the medial femoral condyle. Dissecans of the medial femoral condyle. This is an example of the same pathology, osteochondritis dissecans, but on axial CT scan. So here, there is a detached bony fragment, as well as fissuring of the patellar cartilage. This is a patella, and there's fissuring of the patellar cartilage and detachment of a bony fragment of the patella. Diagnosis osteochondritis dissecans of the patella. The complications here, the common complication here is locking of the knee joint space, locking of the knee joint space. And as you can see here, osteochondritis dissecans commonly in the adolescent age or adolescent to adult age. So this is an example of the same pathology but on MRI. This is coronal stair image of the knee showing that there is a focal area of stair signal hyperintensity. So how do you know that this is a stair image? In stair image, the bone signal is very dark, as you can see here. It's not that moderate high signal seen in T2 or the very bright signal seen on T1. It's here a kind of dark signal. So there is a focal area of stair signal hyperintensity in the articular surface of the medial femoral condyle. Again, it is seen in the articular surface. You can see of the lateral aspect of the articular surface, lateral aspect of the articular surface of the medial femoral condyle. And it is extending to the overlying cartilage. Extending. The high signal is extending to the overlying hyaline cartilage, as you can see here. So there is fissuring of the overlying hyaline cartilage here too. This is a kind of pathognomonic feature of osteochondritis dissecans. Fissuring of the overlying hyaline cartilage. So the high signal, a focal area of high signal the focal area of stair hyperintensity, you can say that this is a detached bony. This is a detached bony fragment, focal area of stair high signal, or you can see that there's a detached bony fragment, or there's a bone defect. It's better to say there's a kind of bony defect, or as a result of a detached bony fragment. Okay, with extension of the high signal to the overlying hyaline cartilage. So this is the second diagnostic feature or pathognomonic feature, which means with fissuring of the overlying hyaline cartilage. Okay, so the diagnosis here is osteochondritis dissecans of the lateral aspect of the medial femoral, lateral aspect of the medial femoral condyle. Okay, same pathology but in different site. Not here. This is the normal. Just I need you to check the normal anatomy here. This is the right talus. Okay, this is the right tibia, and this is the right fibula. Okay, so let's see the abnormal here. Here's the abnormal. Look here carefully. This is the talus, okay? But the talus here show a fracture. It's called subtalar fracture. Okay, this is the subtalar fracture, or it's called osteochondral fracture of the right talar dome. So this pathology is always on the right, okay? So this is a fracture, osteochondral fracture of the right talar dome, okay? Okay, let's see here. This is not osteochondral fracture. This is osteochondral defect. Here, osteochondral defect of the right talar, of the medial aspect of the right talar dome. So osteochondral defect of the medial aspect of the right talar of the right talus. Okay. Again, osteochondritis dissecans here is commonly to be seen on the medial aspect of the talus, just like the medial femoral condyle. Okay. Okay, of the talar dome. Let's try to check the osteochondral defect here. I can see it here right now. Okay. Maybe. Okay, there is another osteochondral defect here, so you need to check the ankle radiograph. Any ankle radiograph, you need to check it carefully for, especially on the medial aspect of the talus. As you can see here, there is a osteochondral defect on the medial aspect of the left talar. Osteochondritis dissecans, commonly seen on the medial aspect of the talar dome. That's it.